Thoracic outlet is the region between the clavicle and the first rib. There's going to be several structures. There's going to be traveling through the thoracic outlet. We have the subclavian artery, the subclavian vein, and the brachial plexus traveling through the thoracic outlet. And if these structures get compressed, then this results in thoracic outlet syndrome. Depending on which structure gets compressed, that results in different symptoms. For example, if the subclavian artery gets compressed, then that will result in exertional pain. So if the patient is moving around their arm, then they're going to be experiencing pain. But if they're at rest, they're not going to be experiencing any pain. If the subclavian vein gets compressed, then that will result in congestion, that will result in swelling. If the brachial plexus gets compressed, then that can result in weakness, pain, as well as tingling. Thoracic outlet syndrome can also occur with compression of the brachial plexus in the scalene triangle. The scalene triangle is going to be made up of the middle scalene, the anterior scalene, and the first rib. So here I'm going to be highlighting the scalene triangle. As we said earlier, is going to be made up of the middle scalene, the first rib, and the anterior scalene. And if the brachial plexus in yellow gets compressed, then that will also result in thoracic outlet syndrome. Now, this can occur with inflammation of the scalene muscles over here. It can also classically occur with an extracervical rib. If there's an extracervical rib, then that can inflame the scalene muscles and also cause disruption of the brachial plexus that can result in thoracic outlet syndrome. If we go to the next slide, we have a quick summary of what we just discussed. Thoracic outlet syndrome is going to be due to certain compression of components that are traveling through the thoracic outlet. If the brachial plexus is compressed, then that can result in weakness, pain, and tingling. If the subclavian artery gets compressed, then that can result in exertional pain. And if the subclavian vein gets compressed, then that can result in swelling. And again, compression of the brachial plexus that is traveling through the scalene triangle can also cause thoracic outlet syndrome. This can occur with overuse injury or inflammation of the scalene muscles. And as we said, it can also occur due to a extracervical rib.